Hi guys, welcome back to the channel after Sunday. Hope you have enjoyed your Sunday. So we will continue with Exodontia. We have dealt with definition, indication and contraindication of Exodontia. Now we will see the basic principle methods of Exodontia. Okay, let's start. Now coming to basic method, there are two type of method. A closed, which is also known as forceps method, intraalveolar method or conventional extraction, and second is open transalveolar method or surgical extraction. So what are the principle of extractions? There are mainly three basic principle of extraction. First one is expansion of bony socket. How does that happen? By the use of wedge-shaped beaks of the forceps. Forceps should be seated with a strong apical pressure to expand the bone. We should always remember that. Always remember that. Forceps should be seated with strong apical pressure. Okay, then use of lever and fulcrum, in which alveolar bone act as a fulcrum, and third is insertion of wedge, that is same as this, by the use of wedge shaped beaks of the forceps. Okay, now coming to pre-surgical assessment. Before starting a patient, we should know all the history of patient. सबसे पहले we should know the medical history. If he or she is suffering from any endocrine disorders like diabetes mellitus or hypertension, hyperthyroidism, or any blood dysphagias or any routine medical history he or she is giving, or patient is on some drug which should be stopped or which should be continued, or any cardiac issues. Now coming to dental history, why it is important? It gives us the how previous extraction was with the patient. It was painful or it took time, or how was the bleeding process? It stopped after a few minutes or it continued to bleed. So, or any drug allergy. It should be noted. Dental history is very important. Now coming to patient's emotional maturity, sometimes patient is aged but emotionally he or she is immature, so we should know that. Then coming to clinical and radiographic examination. In clinical examination, we should see first of all the accessibility, the mouth opening of the patient. Some patients come with trismus, some other cause of reduced mouth opening. Then tooth mobility, if the tooth is mobile or not. Accordingly, we will act or we will perform extraction. Then if there is presence of infection or not. In LA we have dealt, if there is infection, LA doesn't work due to the pH difference, so we have to give medication and recall the patient for the next appointment. Now coming to crown condition of the tooth, as in it has caries or large restoration, etc. Oral hygiene status is very important. First of all, we should know that if the oral hygiene status of the patient is very poor, please first do the periodontal thing and then start with extraction. It will infect you also, the patient also, and the work also. Now last is tooth alignment in the arch. How is tooth? It's buccally rotated, it's inverted, whatever the alignment. We should first check that and then follow the extraction. Now coming to radiological examination. It is very important. Indication for pre-op radiograph. What are the indication when we should take the pre-op radiograph? Firstly, history of difficult or attempted extraction. ये हमको पता चल जाएगा जब हम हिस्ट्री टेकिंग लेंगे पास डेंटल हिस्ट्री में. Then tooth abnormally resistant to forceps extraction, that is ankylosis. If a transalveolar approach is going to be used, we should evaluate the dental status and we should act accordingly. Teeth or root in close relationship to the maxillary sinus, inferior alveolar canal or mental nerve. Okay. All mandibular, third molar, premolar or misplaced canine should go from preoperative radiograph. Heavily restored or pulpless, that is RCT treated teeth. Tooth affected by periodontal disease because it is accompanied by some sclerosis which thicken the bone and make the extraction difficult. So we should go for an pre-op radiograph. Tooth subjected to trauma, isolated maxillary molar. This is important because it sometimes we can see the effect of seeding. Partially or unerupted tooth, obviously retained tooth, Okay, now coming to any condition which predisposes to dental or alveolar abnormalities. For example, osteitis deformans, that is Paget's disease, in which the roots are hypercementose, which makes extraction very difficult, and there is predisposition to chronic osteomyelitis. Okay. Cleidocranial dysostosis, in which there is pseudoanodontia and hooked roots, which again make the extraction difficult. So we should know about these conditions, we should able to rule about this condition and act accordingly. Therefore, history taking is very important and pre-op radiograph is very important. Now, condition predisposing to dental abnormalities, for example, patient who have received therapeutic irradiation of jaw, this we will come to know in medical history. Then osteoporosis disposes to chronic osteomyelitis. Now, relationship with maxillary sinus, we know that if there is a close contact SAB, we should go for, if we are extracting upper 6, 7 or 8, we should definitely go for a pre-op radiograph. Okay, if only a thin layer of bone is present between the sinus and the molar teeth, there is increased potential for perforation of maxillary sinus during extraction. Okay, perforation के chances increase हो सकता है, which may lead to OF, यानी oral antral fistula. Configuration of root is very important. First, evaluate the number, then curvature, size, shape, length. Root caries, root resorption can be internal or external. Previous endodontic treatment and condition of surrounding bone. This should be evaluated. Now last, I want to give you one mnemonics for this, that what are the 7 minimal essential things for extraction. This is the mnemonics, that is RAFFLES, raffles. R for radiograph, A for aesthetic, F for forceps or elevator, again F for flap tray, that is surgical tray of instrument, we will dealing with this. Then light, very important, efficient assistant, very important, and suction apparatus. Okay, these are 7 minimum essential which should be there when you are performing extraction. Okay guys, finishing of today's class, we'll be dealing with patient position and instrument and some of the technique in detail, how we will do when there is close approach or how we'll do when there is open approach. Okay, bye. Like, comment and subscribe.